Time now for another edition of Wellness Wednesday with Dr. Bradley Meyer from the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave.
Well, we're going to continue with a pretty remarkable story that's underway, a huge success story at Okoboji Wellness Clinic, and that's with Josh, and his story's been incredible. He told us how he's been on anxiety and depression medicines for 20-some years, 42 of those medicines over those years, and he has begun quite a journey with you at Okoboji Wellness Clinic.
He has, and what we really like to see is these responses that are very difficult to find words for, but when you see it in the person's demeanor and eyes and how they move, Josh did a great job. He did a great job of finding the words for it, though. So we've added IV ozone therapy to his regimen, and today he was going to talk a little bit about that. And so the IV PRP or platelet therapy has been another piece going forward. The PRP therapy or TruDOSE, it's a phenomenal approach where what happens in the body many times when there's wounding, whether it's the brain or the heart or the lungs, and this can be an emotional wounding, it can be a physical wounding, cells get stuck in what's called a cell danger response. And then if it doesn't get out of that cycle, it can develop into a space of chronic disease and chronic inflammation, and then that's where we run into some problems, and folks can get into these bad cycles, not feeling well. And so these TruDOSE treatments, Josh, I believe he's got a couple now, and then the ozone. So I'm just going to turn it over to Josh and let him share his story. But again, every week I'm reminded of these foundational tools and the different folks that come into the clinic and the responses that they have. Ozone therapy, again, 3 oxygen molecules, and they work to bolster the immune system. There are many antimicrobial effects to them, which can go after, infections and bugs, and so it's very supportive of the body. We always talk about the role it plays in pain as well, injections with ozone and prolozone. So without further ado, here is Josh.
All right, Josh, so let's continue with your story. It's remarkable. Again, you were diagnosed with anxiety, depression at a very young age, really a child in your school years. And if I recall right, you're, in your early 30s now?
Yes, that is correct. 33 years old.
All right. And, you have been through a plethora of medications, and you decided you would like to go maybe a different route. Now, you're still on medication, but you're trying to wean off some of these medicines. You've had some success with ISIS, and now with hyperbaric therapy, I believe, and now you're trying some other tools in the toolbox at Okoboji Wellness Clinic to continue your journey.
That is correct.
So,
and recently started with the ozone, and I've done TruDOSE 2 times. So we can start talking about the ozone. It was just added to my regimen just a few weeks ago when I brought it up. And I think a summation of what goes on for any person with any problem, mental health, physical health whatsoever, is inflammation in the body. Depression and anxiety can be inflammation in the brain. You can have pain in your body that's a result of inflammation. So basically everything that I'm doing, and my blood tests that I've taken, some comprehensive blood tests, have shown that I actually do have inflammation in areas of my body. So there's not really a test to show inflammation of the brain. But if it shows that I have inflammation in other parts of my body, it would make sense that I have inflammation in my brain that has caused a lot of these problems all along for, most of my life. So what the ozone does is you get those treatments, and those O3 molecules go directly into your body, and they help fight inflammation. So what was surprising about my first treatment with ozone last week, and it was only at half dosage because that's kind of where you start off, is I did not expect the energy boost that I got afterwards. You come in here, they hook you up, and they take, how much of the blood do they take from you, Dr. Meyer?
Or syringes,
about 120 cc's of blood. And then what they do is then they hook that up, and then they use their machine to turn oxygen into O3 or ozone, and then they inject that into the bag of blood that they took, and then that blood gets put back into your body. And what was astounding to me is as soon as I was done with the treatment, it felt I was in a better mood, even though I was in a fine mood to begin with. I had more energy. It was really astounding how that worked so quickly, and I can only imagine what else it's doing for the rest of my body if it's mentally making me feel good at the same time.
Josh, before we talk about TruDOSE and platelet therapy, so your story is a little interesting. Well, it's a lot interesting, but you searched out help on your own accord. You were searching for somebody that was a traditional doctor, but also could maybe do some integrative, non-traditional therapy as well. That's what led you to Dr. Meyer, right?
That is correct. It was a simple Google search of functional doctor near me.
So you have really turned into your own advocate. You have researched a lot of these treatments that that Dr. Meyer uses. It's not like you're going in completely blank.
No, in fact, I have a touch of autism, let's put it that way, high functioning autism, and I can guarantee you that any treatment that is recommended or that I hear about, I will find a rabbit hole to go down and spend about 5 hours reading about from different angles. And when I read about all these treatments and I realize that, wow, these treatments are available near me all in one place, it's just astounding. So yeah, I do my own research beforehand on everything. And as I stated in my last interview, I used to research medications. For 23 years of my life, I was researching what pill can I take to make me feel better? What pill can I take to make me happier? What can take my pain away? And I finally realized after, like you said, 42 different medications that maybe looking for a pill is not the proper way to handle this. Maybe I have to address the core problem with my body.
Yeah, and you brought up inflammation, and I think Dr. Meyer, right from the get-go, has taught us all well that inflammation, no matter where we're trying to get at as far as the core of our disease or not feeling well, inflammation plays a gigantic role. So let's talk a little bit about the TruDOSE and what the TruDOSE is doing to help you in your journey.
So TruDOSE is technically PRP. It's platelet therapy, but it's more advanced than that because a wonderful doctor from Texas basically had a revelation that said, okay, we can do these. You can have basic PRP therapy. A lot of athletes have it to heal. But this doctor said we can target this to specific individuals by running the blood through certain tests to show how we can utilize this most effectively. So what you do is you come in for TruDOSE, and again, they take your blood, and then they will go in the office here, and they will run it through a machine that then goes to some doctors that know how to look at the blood, and they will analyze the best ratio of plasma and platelets for your body individually. That's why TruDOSE is an individual PRP, platelet replacement therapy treatment, more than just your overall generalized PRP treatment. And what's amazing, my first TruDOSE that I had, they tell you, oh, you can, feel a certain way after you have it, expect maybe not to feel well and stuff like that. And I was excited for it. And then the next day, I realized that I had some pain in certain areas of my body. Well, a year ago, I had surgery, a bascum cleft lift, because I had a bunch of pilonidal cysts that needed to be taken care of. And man, where I had that surgery, I had a lot of pain after my TruDOSE treatment. And I researched a little bit, and I realized that I probably had some stuck cells or inflammation, as Dr. Meyer talked about, that was still hadn't completely healed from that area. And these platelets that were injected back into my body were going to all these areas throughout my body that weren't repaired correctly and fixing them. I remember my shoulder having a little bit of pain. I've had shoulder issues in my life. And I went, if this is happening in parts of my body that I wasn't expecting, where what I call the area has been stuck. It's been stuck with toxins. It's been stuck with, not being able to heal correctly. I can't imagine what it's doing for my brain. And I stated that I have, a little bit of autism, and TruDOSE is especially beneficial for people with autism. Autism has been, you can talk about vaccines, you can talk about how it relates to the gut, and TruDOSE affects all of those areas. So when it's repairing your body, you probably can't feel how it's also repairing your brain because, your gut and your brain are connected. So throughout this TruDOSE therapy, I had my second treatment 2 weeks ago, and I had pain after the treatment in a few areas that I didn't expect either. I had some in my leg and my knee, and I went, I've never had injuries to these places. And I remember telling my mom, I said, oh, Mom, my back hurts. Can you step on it? Not the wisest thing to do. Most doctors will advise against that. And she stepped on it, and about 2 hours later, I was feeling absolutely miserable. And I went and read my TruDOSE packet they gave me and said, oh, you're not supposed to have chiropractic treatment for like 6 weeks. And I realized that whatever was there was probably a bunch of toxins that were stored somewhere in my body, and they were released back into the bloodstream. So what the TruDOSE is doing is it's taking those toxins, and after you do your TruDOSE treatment here at Okoboji Wellness, they give you what's called a BIRAD chem binder, and you're supposed to take those for 3 days. So the toxins that the TruDOSE in your body is releasing and trying to get out of your body, it wants something to bind to for your body to be able to excrete it. So you take these chem binders for 3 days, so the toxins that are released through the TruDOSE are then excreted out the body through your waste. So if I had this feeling of, pain over all other parts of my body, I can only imagine what's going on in my brain and the healing that it's doing in my brain at the same time. And I think it's really revolutionary because it's such a targeted treatment for the individual.
Yeah, absolutely. So I know it's only been a few weeks since we've talked, but your ultimate journey here is, of course, to peel back the layers of the onion here and to find out why you're not feeling well. But that journey's going extraordinarily well. You're feeling much, much better. You've told us that your family and friends recognize a significant difference in you already. Your goal is to not necessarily get off all medication, but you want to wean down your medications. How is that going?
Well, I have cut one of the pills that I take in half. And being on 6 medications, as I mentioned, people think, oh, wow, you've cut one pill in half. What a big deal. Let me tell you that I've been through traumatic experiences going off of medication too quickly. So starting with cutting one pill in one half, and I don't care if it takes me 6 months to get off this one pill, doing it correctly. When you add on all these treatments that I'm doing here at Okoboji Wellness, that are going to help boost my body naturally, boost the neurotransmitters in my brain and stuff like that. As I get off these medications, it's going to make it so much easier than just going off a medication with no help at all. Mm-hmm. So yes, I'm on 6 medications, and I've successfully, after 3 months of being here, cut a pill in half. But that is huge for me because I cut the pill in half, and I didn't necessarily feel any negative side effects, which is absolutely amazing. And for all the people out there that have tried going off medications like this, you can understand the absolute hell that you go through when this happens. So little by little, you do this slowly and correctly, you're going to be able to do this.
And that's one of the reasons a lot of people, Josh, get stuck on these anxiety and depression meds is the withdrawal symptoms from some of these medications are just absolutely vicious, and you can be a testament to that.
Absolutely terrible. And people that haven't experienced it when trying to go off a medication have no idea. You feel worse, way worse than you did what you took the pill for in the first place.
Yeah.
And that's why I like to put it this way. We're not addicted, those of us that are on SSRIs or other types of medication, we're not necessarily addicted to these medications. We're dependent on them, which means that your body is dependent on them and your body has gotten used to them. So when you try to take them out of the body, it's going to respond in a negative manner. That can happen with any medication you're on, being a psych med or not. But when it's a psych med especially, and you take away that crutch that it's using in the brain where it's, reuptaking all of that serotonin, and the brain that's being taken away, it just can be awful. So yes, the withdrawal is absolutely horrendous, and I can attest to that. And that's why that I've learned after doing this numerous times of doing it very slowly, very methodically, correctly, with the benefits of treatments that I'm doing here at Okoboji Wellness to help my body naturally produce these chemicals that these medications were either inhibiting or reuptaking at the same time.
Josh, we're out of time here, and I know we're going to have you on again. Real quick, though, I know you've worked with Molly Avery. Her nutrition specialty is extraordinary. How much has nutrition played in your journey?
Since I've started here, it has played a significant role. I can't say that I'm 100%, following the diet exactly, but I've cut out a ton of gluten. I've cut out a ton of sugar, and there's a huge difference, especially just this last weekend. I was at a place that had some birthday cake, and I ate a piece of birthday cake, and I hadn't had that much sugar in who knows how long, and I felt awful afterwards. So nutrition is definitely a big part of it, and it's going to be a big part of it for anybody that's working through this process. So yeah, Molly has been great, and I look forward to being on with her when that time comes. Very
good. Josh, thank you so much for continuing to share your story with us. It's a remarkable success story. Continued healing, and we'll talk to you again with Molly, I believe, down the road. Best of luck.
Yes.
Best of luck. Dr. Meyer, it's an incredible story. You've talked a long time about tools in the tool belt. I actually watched a video yesterday concerning ozone, and that doctor, similar story that you like to talk about is some things, why you want different tools in the tool belt, some things people are not receptive to. And so maybe red light therapy doesn't work for everybody, and it does for some. The same thing with maybe ozone. Maybe people might be, what's the right term? Like one pill is good for somebody and the other person has a negative reaction to a pill. Not every tool works for everyone.
Right. Absolutely. And the tools that we utilize, it's typically not necessarily that these I would call them gentle treatments. In most cases, some of these tools, folks will feel like a dramatic change for the better, and other ones, they might notice that change over a longer period of time. And some folks, they just don't feel like it's moving the needle as well. And so that's when we can look as to why and maybe try something else. The other thing that's important to remember is there's a term called Herxheimer's, which is a reaction that when the body is trying to find balance and reduce inflammation and remove toxins from the body. Again, toxins can be many forms, from mold to heavy metals. So many, even the microplastics are a big thing that's out there, a lot of press right now. When you're moving those out, sometimes you can have a sensation of almost like a flu-like symptom where the body's removing those things. And sometimes that reassurance is all that's needed in sharing with folks that this is kind of part of the healing. So there are some days where, you really can feel energized and less inflamed. But if that sensation is not necessarily a bad sensation, but it's up to our medical team here to evaluate that. And in the case of Josh with the IV, PRP, and TruDOSE, that is what he was sharing, that physical experience of those platelets going to an area of some prior wounding and doing some extra cleanup work that needed to be done. But when you know that's happening, it's reassuring to know that, that process is what we call like festering a little bit. And we don't want that fester to, if you got so many little fires festering over time, that adds up to more stress on the body.
Right.
And so another reason why this approach it's good, because those platelets tend to seek those areas out that need to be sought out.
Very good. It's an incredible story. It's just an incredible success story. We need to run. If folks want to visit with you, Dr. Meyer, what's the best way to get a hold of you at Okoboji Wellness Clinic?
Yeah, 712-339-6024. Molly Avery, Mychal Sheridan, myself, we do free discovery calls for 15 minutes. If you've got questions, if you're ready to just get going and do an hour visit with us, give us a call and get scheduled. We're at 3305 Berkwist Avenue in Spirit Lake off Highway 71, just next to Ace Hardware. We are here to do that initial visit, which is typically an hour long, or that free discovery call if you have further questions before that first visit. But let's get started.
Very good. Dr. Meyer, thank you so much. Have a great day. We'll chat again soon.
Thanks, Dave. Be well.
Thank you. Dr. Bradley Meyer at the Okoboji Wellness Clinic. You can find out more online as well. OkobojiWellnessClinic.com.